to introduce to you a very special teacher from Mumbai, my colleague, and a really beautiful teacher, Dr. Mayuresh Mahajan. I do believe that I haven't seen any lecturer from India who teaches with so many expressions as much as Dr. Mayuresh Mahajan does, with his very unique style of imitating the patients. It is fascinating to watch his lecture. And when I decided that I wanted to do this kind of pediatric course, I knew one of the first persons I wanted to invite as our keynote teacher was Dr. Mayuresh Mahajan. I'm not going to give you a big introduction to him because many of you may be hearing him for the first time. I saw him first time about 12 years back, probably 11, 12 years back, when I was then learning with a group called as HHF group, which is a very special group based in Mumbai. And that time, the teacher and the originator there, and also one of my teachers, you can see probably in my picture here behind one of the doctors here, just behind me is on the extreme left is Dr. Mayuresh Mahajan and my teacher, Dr. Milind Rao. So he's one of the teachers from whom I learned the most, and he used to teach in a very special way of understanding the mind rubrics. Um, it was a very special technique that he especially spread in groups, especially starting in Mumbai and in Maharashtra. And that is when he introduced Dr. Mayuresh Mahajan sir to us. And the first lecture that I heard him say, and you have to understand, I was just an intern that time, and I just knew that he's very special. And from then onwards, we were in touch, and I was always in touch with the group. Going forward, so it's such a pleasure to have you and have you collaborate with us. We are fruits, probably leaves from the same tree somewhere, Dr. Mayuresh Mahajan. It's such a pleasure to have you here. All the doctors look forward to hear from you.
Yes. Gaurang, so sweet of you, man. I told you, na, 2 minutes back.
Yeah.
I don't know. I feel very homely when I'm in front of you, and I don't know what relation we share, but definitely there is a bond between you and me. Starting with the session, I would like to say something about a homeopath. A homeopath, I could see Gaurang, see his energy, the passion. I think everyone amongst us should carry an energy, that passion, that love towards homeopathy, that devotion, that dedication. Because without this, it is not possible. And my dear friends, we together will make a difference in this world. There are so many tools, so many dimensions in homeopathy. The physical genres, the mental genres, the location, sensation, the sensation method. Everyone has their own wonderful thought process. And my topic today will be a behavioral materia medica. Means what? A child with so many different thought processes. When the child comes to your clinic, how does he adapt with the situation? How does he express himself? Very interesting. And child, if you'll ask me, my most favorite topic, because if at all you want to understand pediatrics, you should be a child. There should be a child within you. Without this being a child, you cannot directly approach a child, because this child, when comes in front of a doctor, obviously after vaccinations and everything, he is so much fearful with the overall circumstances and the environment, and you need to make him free. So one real picture in front of you, and that is where our quality as a physician should be like a child. Hey man, how are you? Oh man, yo. This is very interesting. And the behavioral material, this is one of the tool to prescribe upon a child. Every time, there is a 6 months old child, the child cannot express his symptoms. A 9-month-old child cannot express his symptoms, the totality will be just totally relied upon the parents. But we as a physician, what is to be observed? This is number one, which is what I'll be taking. Number two, a child is a child, man. He doesn't has any responsibilities. He doesn't know what is mannerism. He doesn't know what is discipline. He doesn't know that yes, you have to pray, you have to work hard, you have to, he wants to be very free. So make the child in front of you very free in your clinics, very free. Give that liberty. Let them break a bottle of your medicine, no matter what, man. Let them break. But you need to make them free. The atmosphere should be very, cozy, very warm, isn't it? So I will be taking some situations in a clinic which are most common in your clinics, which are you will encounter those uh, scenes in your clinic almost daily. Understand? So the most important, whenever a child gets fever or cough or there is pain in abdomen, whatever, the most important thing is what, my dear friends, is the child becomes irritable. So this is a very common phenomenon where the child becomes irritable. So I have, selected most able kids in front of you and how to differentiate it. A 7-month-old child suffering from fever, cough, it may be bronchitis, it may be pneumonia. Okay, but the presentation of this child in front of the physician is really very interesting. So how to differentiate the irritable kids? How to differentiate the irritable kids is really very interesting. Now, why I fall in love with this behavioral Materia Medica, I'll tell you. My experience, I'm telling you. A child came, this is around 1890. I would like to tell you one thing. I'm practicing since 1998. So this is the 25th year of my practice. And I'm so glad that I have made so many mistakes in my prescriptions. But in order to prevent those errors in prescription, I really feel that you guys should not miss those. So this is the exact main motto of my, this session. The most important thing, the child is irritable and the child was in front of me. Actually, I wanted to show you all videos, but because of those privacy issues, sorry, I cannot present right now. So, but I'll try to act as Gaurav said. If I wouldn't have been a homeopath, I would have been a side actor, at least a side actor. I love acting. So I enact all the kids. How do they react in front of you? And I hope you will recollect those kids in front of you and you said, oh my God, that remedy was chilidonium, that was arsenic acid. Okay. So starting with this behavioral Materia Medica, why did I fall in love with this? I'll tell you. There was a child, 17, 18 years back, I'm talking about a child crying. So the parents in front of me, I was trying to understand what is he suffering from. But the parents said, see, I had been to a pediatrician, but he had given some antipyretics, anticolic, antispasmodics, everything. But somehow the child is not getting pacified. The child is not getting calm. He's just going and this physician, a helpless physician, was in front of, and the worried parents. So, this child, now this is a child, and now the whole scene, I will be taking this as a child. Now you imagine this is a child, okay? So this child was, the poor father was trying to pacify the child. But this child was not getting pacified. He was not getting quiet. He was not getting calm. Come what me. I was so, and whenever there is an irritable child, shrieking, irritable, with full of noise, what first remedy comes in our mind is chamomilla, isn't it? So we have read in our Materia Medica that the most irritable child in the whole entire Materia Medica is chamomilla. But I would like to tell you more 4 remedies which are so close to chamomilla, but what will be the subtle difference? And that observation is very interesting. Now this child was crying. The father said, "No, this is sometimes." I would like to tell you, my dear friends, whatever I am telling you, there are some tips, will you just note it down, and according to your understanding you make notes out of it, and then you'll find those kids. This kid, I was really wondering what to give. Oh, there was no symptomatology, the child was just crying, but that was the only thing what was in front of me. The father said, doctor, in spite of doing everything, I gave him chocolate, I gave him ice cream, I put my child in an air conditioned car, still the child is, I was doing all antics, but the child was quack, quack. They were helpless, the parents were helpless. Now this is where I called my master, Dr. Milindra Rao, and asked, sir, I said, I have a case in front of me and the child is just going and crying. Now, how to deal with such cases? What is to be done? So, shall I give him chamomilla? So, sir told me one rubric. Now, this rubric is very interesting. Just note this rubric, write it down. This rubric, yes, it's a 7-month child. There was no symptomatology, but there was no symptomatology as per a physician. But if you understand the child, there was one clear-cut rubric. In the mind section of the repertory, which was so beautifully put in the repertory, and the rubric was, write it down, mind, quieted cannot be. Just one single rubric. But Kent sir has already told us, yeah, Kalyan, you are right. Kent sir has told us, one strong single mental general can rule out many physical generals. I used to always wonder, a mind, how could we understand the mind of a 6-month-old child? I used to always wonder. But after this session, you will come to know how to understand the mind of a 7-month-old child. So, yes, Khushbu, you are right. See, we have a rubric, quieted cannot be. This one rubric, there is one single remedy, Sina. And I said, it is given in the repertory, it is out of brewing, let us give a dose of Sina. I gave the child a single dose of Sina 200. I repeat the rubric, mind quieted cannot be. In spite of doing all sorts of things, in spite of considering everything of a child, what does the child like? A chocolate, ice cream, not getting pacified, then traveling, not getting pacified, doing what not, all antics, not getting pacified, a toy, a new toy, a small doll, a small fair, that the child is not getting pacified. We have a rubric, mind quieted cannot be. Such a wonderful rubric. And I tell you, my dear friends, this cases you will get in your clinics. Believe me, you will get those cases in your clinics. And just give the dose. Sina, it's not China, my dear friend, it's Sina. Quieted cannot be. Mind section of the repertory, the sub-rubric is quieted cannot be, only Sina. I gave a dose of Sina, and within some seconds, the child went to a deep sleep. And Sina 200 was the dose, and believe me, the result was astonishing, like this. And since then, I fall in love with this behavioral material, the mind. Then I got to know about how to understand mind with respect to a 9-month-old child. Okay.